In 2005, I was actually just finishing med school and working on my doctoral thesis in the field of clinical epidemiology.
I was in Belgium. I was working for the Food Safety Agency.
I was at the middle of my medical school, so I completely remember what I was doing. Not this day, but probably I was doing a clinical rotation.
So exactly at this point of time, I actually do not remember, but I think I was somewhere in finishing my internship in the education for being a physician.
I was actually a 15-year-old. Still finishing high school, not knowing that I would go into medicine, clinical medicine, and then public health.
I was working at Norwegian Institute of Public Health, where I've been working there for 22 years.
Yeah, so in 2005 I had just started as a consultant in London at a hospital which looked after patients with high consequence infectious diseases.
Oh, absolutely. In 2005, I was doing my APIET fellowship in the UK, and I remember very well when ECDC was established because the first director, Susanna Jacob, one of her first trips was to visit actually the Public Health Institute in the UK.
Indeed I do. I'm afraid I'm that old. I can remember it very well. In 2005, I was actually working as a consultant in communicable disease control in the United Kingdom.
Then I was at the first advisory forum meeting in Solna City Hall.
Yes, 20 years ago, 2005, I was just finishing my PhD and having my first baby and thinking of what I will do afterwards with my career.
I was in Sydney, Australia, doing my PhD.
I was heading a laboratory, a public health laboratory, on virology. I was very critical because ECDC didn't have labs, so how could they ever be good? I was very critical.
In fact, I do because I was in Argentina, in Buenos Aires, with Denis Colombier, who became the first responsible for surveillance and preparedness and response at the ECDC. We were delivering a training in epidemiology in Buenos Aires, both together, and when we came back, he came directly to Stockholm for taking his new post.
It's a long time ago. I was just starting my master's at the London School of Economics in Health, Population and Society, so it's going back quite a while.
I am really grateful for ECDC for the training because I benefited from the EPIET course as a fellow of the German Field Epidemiology Training Program.
It's called Public Health Emergency Preparedness Assessment. So every 3 years, we assess countries' preparedness plans
to really touch a little bit or switch the way we look at epidemic intelligence.
Putting public health on the map, like in Europe, and also like training young public health professionals. Without them, we couldn't do our work in the member states.
I was really quite astonished by the level of expertise and the risk assessments that were made available and could be applicable to our national context.
So the networking and the knowledge that they have with all the good people who work there are important. And I think moving forward, emphasis on knowledge and what we have, the evidence that we have, what do we know and what do we not know, and being open about that, I think.
Well, I can think of several. I'm going to pick my top two. So first of all, I think the networks. So building the networks of excellence, building the networks across country where people can come together and exchange the views, opinions, bring the expertise from each country to the other.
Well, it's very difficult to pick and choose one also because I've been at ECDC for 19 years, but I'd like to focus maybe on something that I started at the very beginning of my employment at ECDC, which was establishing a network for monitoring the effectiveness of vaccinations.
There's so many things we could focus in on, but I think in fact the biggest achievement is that it continues to be a sustainable, collaborative movement of experts and member states who collaborate for the common good.
They managed to collect the disease surveillance networks. They were placed all around Europe ECDC managed to bring them all into ECDC itself here in Solna, and managed to also keep the expertise and give the disease networks a solid foundation for the future.
I think one of the biggest things is this kind of bringing together all the member states and working together for one game, for one goal, and building up this really close collaboration with the different disease networks.
I can say about ECDC is the leadership role it plays in coordinating the member states around public health and making sure that every individual on the street receives the best medical care or public health help that the person needs. The emphasis is every person on European soil.
I would say the risk assessments. I think that those are exceptionally well done. They are really evidence-based. They define also where there's uncertainty. They bring in experts from across the spectrum, not only public health, but also academic parties. And their quality is beyond debate. So I really think that's the diamond that ECDC has and should treasure.
There are many achievements of the ECDC. There are also some pitfalls, but there are many achievements of the ECDC. And I think, from my point of view, I don't want to concentrate in specific scientific or technical topics because that's obvious. The ECDC is achieving a lot, but I think it's something much more conceptual. The ECDC has made European member states, EU member states, to understand that we have to be working every day for a stronger public health.
For me, the pandemic was a very big achievement from ECDC. There was so much conflicting information, but ECDC felt like a rock, especially for patient organizations, to be able to get the information, even though we didn't know so much what was happening at the early stages of everything. But it was, I think that was a fantastic job, and it really helped us to communicate and get the information we needed as well.
I hope for the staff of ECDC for the next years that they can really increase their expertise and bring it to the benefit of the population and the European Union, and strengthen the already existing great networks and relations with the federal states.
To really make sure that we put our resources, the Commission resources, the ECDC resources, member states resources, in what is the added value for ECDC, and again, that will have an impact for public health in Europe, but also across the world.
Just keep up the good work and collaboration.
First of all, working as public health institutes, I wish the best of health to all ECDC staff, and the continued work and collaboration and coordination with the different countries with a common vision and mission for the health of EU citizens.
Keep on the good work that they're already doing, and of course with the new mandate there are new tasks and new work to be done, and I'm sure that the ECDC will handle that perfectly.
So my big thing would be to be bold and brave. So sometimes things are uncomfortable or difficult, but that does not mean they shouldn't be tried. Unless we develop innovative surveillance, unless we develop innovative ways of communicating, unless we develop innovative ways of assessing risk, we'll stay behind, we won't move forward. So the boldness and braveness that ECDC has shown over the last 20 years needs to get even bigger for the next 20.
Well, I think we should all be proud and feel privileged to work for public health, particularly in a time where the value of public health and science is challenged. And my wish is that we really thrive against misinformation and against lack of trust by showing that science and evidence really is the main way and the best way to gain trust and to inform the right public health choices in Europe.
The best of health, and I wish them a good working environment and many new challenges. And I think one challenge in particular is important. That's that we keep the trust that the public has in us and in ECDC.
I think we would all like, and we hope that ECDC is growing as much as it was in the past. So it can give its advice and its valuable expertise as well and even better than it did in the past.
I wish that they continue at this level of professionalism. This is not about praise, singing, but this is about what I have seen in the last 1.5 years.
I would say optimism, despite challenges, budget cuts and political issues, because health will continue to be an important topic, and I'm sure it will be looked at as really valuable and essential.
Well, first for the ECDC staff, I wish them to be happy. I wish them to feel proud of being part of the ECDC, and that comes with what the ECDC should do. And if the ECDC keeps on and even improve his role in public health in Europe and becomes the biggest actor in public health in Europe, making, as I mentioned this morning in the meeting, making that Europe, the European Union, is not anymore only the European Union for business, but the European Union for health.
I wish you obviously another happy, successful 20 years. Keep going the way you've been going. But what I would love to see is even more engagement with NGOs, getting the voice of the patient as a natural part of public health.
To become bigger, better, faster and stronger.
So again, I think ECDC has contributed so much in both understanding and addressing health needs. But I think there's a job we all need to do on addressing health inequalities or health inequity. Over the past 20 years, we've seen huge changes in the world and in Europe. But among those, the gap between richest and poorest has actually increased. And some of the challenges around morbidity, mortality, whether that's from chronic disease or infectious disease, and the interplay between them, those gaps have increased. So I think there's a real job of work to be done over the next 20 years in understanding and addressing health inequities and to build in Europe an inclusive health space that is for everyone.
Happy birthday, ECDC!